Hey guys, today I want to talk about Naltrexone. I give Naltrexone all the time to my patients. It's usually prescribed at 50 milligrams for conditions like alcohol dependence or opioid dependence. But here's what's kind of wild. At low doses, doctors are seeing some crazy things. And when I say low doses, we're talking between 1 to 5 milligrams.
And this is the one I use a fair amount, and it seems very alternative, but it's not. And that's low-dose Naltrexone. Low-dose Naltrexone. Naltrexone is a medication that was released decades ago to treat opiate addiction. When you take Naltrexone, it blocks the opiate receptors. So when you do an opiate drug, you don't get the same euphoria. You take the drug and there's nothing. Studies show when people stopped taking their Naltrexone, as Naltrexone was leaving their body, their autoimmune conditions were improving. Turns out, when you do very low-dose Naltrexone, there's a very little bit in your body, not a lot, just a little bit, about 5 milligrams. What it does is it helps reset the immune system. When you take low-dose Naltrexone, it blocks the opiate receptors, and that causes your brain to be like, hey, we need more opiate in that area. So you start making more natural produce endorphins or opiates. At a higher amount, because of that temporary block, your body makes more, and then the Naltrexone wears off, and your body releases more Naltrexone, sort of like a bait and switch. It's a way for your body to surge a little bit more natural endorphins into that space of self versus non-self. And that's been shown to put autoimmunity to rest. I have seen this work in thyroid. I have seen this work in Hashimoto's. I can't believe how well it worked the first time I saw it. It blew my mind.
So researchers are basically thinking that at lower doses, it can help modulate neuroinflammation signaling. And you're kind of not just blocking the opioid receptors. And this is why low-dose Naltrexone has become such a hot topic in the chronic illness world.
For the other areas where LDN is just captivating the world.
Now, I've had some really wacky patient responses. He's dysarthric. He can't speak. He's got weakness. He has hemi body pain, burning pain. This is that central pain. Okay.
Thalamic pain.
So he comes to me several years later, can barely speak at all. He's tried everything. Let's try low-dose Naltrexone. Goes away, comes back a couple months later. Pain is improved. But not only that, he's now speaking and throwing a few words together for the first time since a stroke. I'm like, what the hell? I bump up his dose. You cannot hurt yourself on this drug. He comes back a few months later. He's now talking in sentences. I said, are you sure this isn't due to your speech therapist? And they swear up and down. Absolutely not. I go up to 13.5. And now he's having conversations.
And how's his pain?
Massively better.
What is the downside of this?
I am hard-pressed to come up with significant risks. We have decades and decades and decades of experience with this drug in people with addiction. You can probably find it in your local area at other compounding pharmacies. It usually runs about $30 a month.
So it's basically a free drug.
It's one that I use more and more and more because of its safety profile and its potential for getting me a home run.
I'm not saying it's a miracle drug, but it's a drug that's been on the market for such a long time that used in a different way, it can bring a lot of promise to those who are in chronic pain. And I think a lot more people should at least know about it.
It's one of those things that is just so good for so many people, which is why I love it. Inflammation, autoimmune, which is just about everybody that's out there. Right. So the patients that really come to mind when I think about LDN are rheumatoid arthritis, lupus, MS. I use it a lot for Hashimoto's patients, Crohn's, IBS. It can help with depression, with anxiety, chronic pain, PCOS. There's even been some research in using it for fertility patients. I've seen really good results with it for endometriosis patients, just fibromyalgia. Literally anything that causes pain or inflammation, LDN can help.